have listened to this song. I have listened to this song for a long time, and I did not pay attention to the words. And yes, Anna, this is an excellent way to start our meeting today. Today we have a really packed agenda for the work we're doing together. And we even have a very, very special guest today that has found an organization that has found a way to support the work that we all do in community. So I'm really excited. We have partnered with them for a few years now and are never, ever disappointed. So once again, welcome to our fourth session. And we are going to move right into it because we have a lot to discuss. So take it away, Anita.
Hello, welcome everyone. Yeah, just a little review to always be mindful as we're participating in this session, to respect others, even if their opinions do not agree with ours. You have the raise hand to wait your turn to participate. Make sure you're muted so there's no unnecessary interruptions. And again, be aware of airtime so that we give everybody a chance to speak. Next slide, please. Okay, and then remember the raise hand option is located in your Zoom controls from the toolbar for raising your hand virtually. Next slide. And then we ask that if your name doesn't show up and on the participants or on the pictures, to please change your name so we can identify you and take attendance as is required for our program. And now I will pass it along to, let's see, to Noemi, I think. No, sorry, to Edith.
And I can jump in. I'm not sure that Edith's joined yet. Today, we've got a lot to talk about, as Sandra mentioned. We are going to hand it off to Clarissa in a minute for our land acknowledgement. And we will start with, Sandra will play, well, first Noemi is going to give us some calendar items, and then Sandra's going to play a little video that picks up from where we left off last time. We're going to introduce our special guest today, who's going to be leading a discussion on suicide prevention. We'll talk about the Padlet and some of the responses that you all have left. We have to say, this has been a really active group. We've really enjoyed and just we've learned a lot through your responses. So thank you for being active in that. We probably will move our self-care portion over to our final session next week to give us some more time today to talk about our topics at hand. And Shakira, of course, will lead us in some of those discussions at the end. We have a video to share with you also at the end and some Q&A. And with that, I'm going to hand it over to Clarissa for our land acknowledgement.
Thank you, Jody. We want to acknowledge that we are living and working in the territory and in the waters of the Salish Coast peoples. As uninvited guests, we are operating in the land bordering the waters shared by all the upper Puget Sound tribes, which include the Lumi, Nooksack, Stillaguamish, Samish, Swinomish, Upper Saget, Tulalip, and Snohomish. We also recognize the many enslaved and contracted peoples who were forced to dedicate their work to the construction of what is now Washington and the surrounding areas. For those peoples and their descendants, we recognize their indelible mark in the spaces in which we live and gather. Finally, in recognizing that this land is colonized indigenous territory, it is our collective responsibility to critically interrogate the stories and later lives of these events and to honor and protect and sustain this land. And now I want to pass it on to Anna, who's going to talk about the progress that you have all made.
Well, hello again. Yeah, let's celebrate. Congratulations on finishing lesson 3. Woohoo! Good job, everyone. And next slide, please. And we have several people who finished lesson 4 as well. And there were a few really, really early ones. So congrats to you all. And may I remind you this, we're almost done. This is next week is the last week of this program. So if you're a little behind, it's okay, just catch up. And then our deadline for you to finish right now is May 9th. That's the day of MindFest. So if you finish by then, we're going to have certificates and things that, and certificates and the gift cards that we'll give out for those who have completed all the requisites for the program. So thank you so much. Next slide, and I will pass along to Noemi.
Hello, everyone. Thank you for being here today. I just want to remind you, please take the pre-session survey that I already sent in an email, but I also put on the chat. That way, their friends or they can have a sense that how we started and what we finished after this training. So please, if someone can put in the chat, I think someone, yeah, there you go, Jody. Just put on the chat, please do it. It's not too long, so that's gonna help us a lot. Thank you so much for doing that. And also, we want to remind the calendar. So we already got in a session 4. So thank you so much for that. Like Anna said, we only have one more to go. So it's going to be next Sunday. And then you guys going to have a few time to catch out all the material that is not done yet. So please, if you have question or you have something, just let us know. That way we can support anytime. So thank you so much. And I'm going to pass it to Sandra. Thank you.
Thank you, Noemi. So let's go ahead and play this video, and this will tie up last week and the work that we're doing this week. So let's go ahead and play.
Good morning. Hey, Ricky. Yeah. I like what. Wow, what's up, man? Good morning. Good morning. Good night.
Hey, I just want to let you know that Ricky took his life last night.
Thank you for, let's all take a deep breath in. That is a very powerful video, but it reminds us how important it is, our role as navigators, that sometimes we're very, very, very busy with our lives, and that's totally understandable. And then we get news like that we were not expecting. So with that, I will pass it on to Jody to introduce our very special guest for today.
Thank you, Sandra. And I wanted to just say also that is a very powerful video. Louise, I want to thank you for sharing that with us, to share with all of you. And also that message that sometimes depression isn't obvious. And I know the first time I watched that video, it was a little startling for me. It wasn't who the person I was thinking might be. So with that, I want to introduce you to Charlene Ray, who is from the UW Forefront Suicide Prevention Center. She is also a licensed clinical social worker and has been in practice as a therapist, a mentor, and a grief counselor for 35 years. Charlene teaches mindfulness in schools. She facilitates mindfulness-based stress reduction for teachers, and she's also a Forefront in the Schools coach. And we're very, very lucky to have her with us. And Zoe, I don't know, has Zoe joined us yet? Let's see if she's on.
Yeah, she's on. Yes.
Great, Zoe. I want to welcome Zoe Tapp as well, who is the Evaluation and Program Coordinator at Forefront. Zoe graduated from UW in the School of Public Health in the Community-Oriented Public Health Practice Program. And most of her work in graduate school centered on had a strong social justice focus. And it's so nice to be working with both Charlene and Zoe, and we're thankful for them to be here today. Please do Zoe a favor, and that link that I shared in the chat, that's actually a pre-survey for today. So if you haven't taken it, if you do it right now, that would be wonderful. And I want to turn the time now over to Charlene, and also ask Zoe. Zoe, do you mind sharing your screen?
And before, Jody, before we do that, just a reminder to those who are present to please make sure your name is clearly visible, even if your camera's not on, because we're taking attendance and it's important that we know who you are. Thank you.
Zoe, I will change that right now for you. I'm going to stop. Actually, Noemi, yeah, there you go. Okay, now you should be able to share.
Perfect. Wonderful. Thank you, Jody, for the introductions. I want to just welcome everyone to this part of the training. This is our L.E.A.R.N Saves Lives Suicide Prevention Training, and I'm so happy to be here with all of you, and so excited for the training that you have already been involved in, and for the work that you are doing and will be doing. So let's go on to the next slide. We can actually probably just jump ahead too, because you did such a great job of introducing me. I don't probably need to say any more, but I will say a little more about Forefront for those of you who are not familiar. Forefront Suicide Prevention is a center of excellence at the University of Washington. And our mission is really to help people take action to prevent suicide in their communities. And we do that through trainings such as this one. And we also train many different organizations and groups of people, people who are required to have training, such as dentists and veterinarians and clinicians, and also other groups of people who really just desire to have this training. And we really believe that everyone can benefit from it. We also have our Safer Homes, our Safer Homes programs, and also we have work that we do with Forefront on the systemic level in the legislature as well. I just want to make sure the sound is good. I noticed that there was some comment that the sound is low. Can people hear me very well?
I can hear you fine. I was
Okay.
wondering if, Jewel, you can double check on your computer volume and see there's an option there for you to raise the volume, because sometimes that gets turned down. Is there anybody else who's having an issue with the volume? Yeah, so it might
Okay, good.
be your computer. Let us know,
Good.
Jewel.
Good. I know sometimes when you go from one mic to another, it can do that. And so good. Just want to make sure. So let's go on to the next slide. And I think a few housekeeping things. Most of you are aware of all of the Zoom details. You've been working on Zoom for a bit, but this training takes about 60 minutes, and you will get a copy of the slides. We send those out in PDF form. And if you have any questions, you can put those in the chat, and I love to take questions as I go along. And even though we don't have a lot of time, I really feel like your questions are important, and it seems like we'll have a little time at the end too for questions. All right, let's go to the next slide. So as you know, this topic can be emotionally challenging for a lot of people. The topic of suicide prevention is hard. And these are hard conversations, and many of our lives have been impacted by suicide in one way or another. So I really encourage you to take care of yourself during our time together, to step away for a moment if you need to talk to someone after this training if some feelings come up for you. Really encourage you to do that, and just take good care of yourself during and after. All right, next slide. So we're going to I just want to give you a moment here, not too much time, but just to get a little sense in the chat of what you hope to gain from today's training. And it could be just a few words about that. As you think about learning about suicide prevention, what would be most helpful for you? And that helps me to make sure I cover those things as we go along. If anyone wants to comment, give you a moment to do that. Yeah, confidence on how to approach someone. Yeah, that's really good. And normalizing the conversation, that's definitely what we want to do. Correct language to use. We'll be talking about that. Yes, language to use in the conversation, when to approach. Great. All right. Let's move on to the next slide, and I'll keep an eye on the chat for other things that come up. So we're going to start by talking about the public health issue of suicide a little bit, and consider a theory of why people may consider suicide. And then the bulk of our time is going to be on the L.E.A.R.N skills, where we'll learn how to identify, understand, and be ready to support someone who may be at risk for suicide. And then we're going to watch those steps, those L.E.A.R.N skills in action in a video, in a practice scenario, so we can see them in action. That's always helpful. Okay, let's go to the next slide. So after this training, we hope that you will use what you've learned to reach out to someone in distress, that you will use the term died by suicide if you aren't doing that already. We may be giving you some additional 24-hour resources that you don't already have, and we'd love for you to add those to your phone. And we also at Forefront talk about how we can help to make our own homes safer to help prevent suicide. So let's start with a few things that we know about suicide. There's a lot that we don't know, but we do know some really important facts about suicide. For one, we know that suicide affects all communities. We can find suicide in any community. If we think about people who live in rural communities, urban environments, people of different cultural backgrounds, different ages, we will find suicide in all those communities. We do know that suicide affects some communities with a higher risk, right? So individuals in the LGBTQ+ community are at higher risk. Individuals in our Indigenous communities are at higher risk. Youth can be at higher risk. So, but the important takeaway is that this can affect anyone. Also, really important takeaway is that asking about suicide doesn't cause suicide. This is one of the most important things I think that we'll talk about, because it's very common that you might hear someone say that they hesitate to bring up suicide or to ask about suicide because they don't want to put the idea in someone's head. And what we know from research and anecdotal evidence is that asking about suicide doesn't cause suicide. It doesn't put that idea in someone's head. In fact, it can be a very effective way of helping to prevent suicide. So we always say there's no harm in asking. Asking about suicide doesn't cause suicide. We also know that suicide results from multiple complex factors. Sometimes we hear about one thing that has happened just before someone takes their life, and people can sometimes say that that's the reason. But when we look at a person's life, we can almost always see that there were many factors, sometimes going back as far as adverse childhood experiences or an early trauma. So it's complicated. It's usually not simple. So those are just a few things we know. And let's go to the next slide. We also know some really important things, and this is where the hope comes in, I think, into this presentation. I mean, certainly learning the skills and using them is hopeful, but thinking about protective factors is really important, because this is something we can do, right? This is a way we can have a positive impact. And one of the most important things we know that about suicide prevention is that creating connections is an important protective factor. So if someone has a connection to friends, to family, to their culture, their community, to a mentor, to a navigator, to someone important in their life, it can make a huge difference. So creating connections is a really important protective factor. Also, limiting access to lethal methods, those things that someone could use to take their life, such as firearms and medications, is protective. Teaching and helping a person utilize coping and problem-solving skills is an important protective factor, and something that we can definitely make a difference with. And then, of course, if a person has access to physical and mental health care, that can be a protective factor when they get that kind of support that they need. All right, next slide. So we'll look at a few statistics here. So in 2021, these are the fatal outcomes and non-fatal outcomes. We can see that there were over 48,000 lives lost to suicide. It was the 11th leading cause of death, with the highest suicide rates among white males, American Indian, Alaskan Native males, and Black males. And then if we add in those non-fatal outcomes, we see that there were over 1 million suicide attempts, which comes to about 1 attempt every 26.2 seconds. So this is why we're here, right? Because these numbers are very high and very concerning. And if we look at the next set of numbers, we can also see some definite concern here. This is what youth in Washington State are saying. And again, we have some more updated data that we'll be sharing soon, but this is from the Healthy Youth Survey of 2021. And it shows how youth responded to questions related to suicidal feelings and actions. And as you can see, our 8th graders, 10th graders, and 12th graders, pretty much around 19 to 20% of them reported considering suicide. And then 16% of the 8th and 10th graders and 15% of the 12th graders reported making a plan for suicide. And then 9% of the 8th graders, 8% of the 10th graders, and 7% of the 12th graders reported making an attempt. Very high. Yes, someone says they're shocked by how high the number is. And I think, when I first saw this, even though I've been working in the field for decades, I am still shocked by how high the numbers are. So it is, again, why we're here and looking to make an impact, on how we can help. Let's go to the next slide. So let's just pause for a moment and think about, why do people consider suicide? That video that we watched is staying with me. I've seen videos similar to that, and I think it does show us that we can't always know what's going on inside someone, right? And even when we're talking about warning signs in just a minute, it's kind of, we may or may not always be able to identify what those warning signs are. But we want to certainly know what we're looking for, what we're paying attention to. But someone who's considering suicide, is really experiencing this imbalance here that you see in this slide, where their ability to cope is it's not enough to deal with the amount of pain that they're in, and they're feeling like a burden, right? Like people would be better off without them, that their life doesn't have a lot of meaning or purpose, and they're feeling alone, like they don't belong, feeling isolated, feeling lonely, hopelessly. There's a hopelessness about this, right? Of feeling like it's never going to get better. And it's causing this unbearable, overwhelming pain that they don't know how to get out of and how to cope with, right? So that ability to cope is less than the pain, and they don't know what else to do. So that's when someone's risk goes up, and they start to think about suicide as a way to get out of the pain. And let's look at the next slide. So again, here, just thinking about that, what might be going on with someone who's thinking about suicide. You know, there is this sense, it's kind of like being in a dark tunnel, perhaps, and there's no way out. You can't see any way out, at least, right? And a person who's feeling this way is often exhausted, right? Physically, emotionally, spiritually, on all levels, mentally exhausted. And sometimes they can't even ask for help. They don't know how to ask for help. They don't have any energy to ask for help. And so that's where we come along, right? And we can come along and reach into that tunnel and say, you know, I'm here for you. And what we want to remember is that suicide isn't always about wanting to die, but it is wanting to end that overwhelming pain and not knowing how. All right, let's go to the next slide. So I mentioned this in the beginning, and our language really matters around lots of things, right? We know that, and around suicide for sure. So we want to move away from using the word committed suicide and saying died by suicide or took their own life. Why do you suppose that would be important? Does anyone want to think about that and respond? What do you think? Why would it be important to not use that word committed? What do you think about when you hear that word? Yeah, it sounds like a crime, right? It's, yeah, and it conveys something not good, kind of prohibited, a crime, a sin, a judgment, right? Again, what we're trying to do with anything related to mental health or suicide, right, is remove that judgment and stigma. And so saying words like died by suicide or took their own life are factual statements about what happened, and much more respectful. And many people who are suicide loss survivors who've had a loved one die by suicide say that it is much more respectful to hear died by suicide or took their own life, rather than using that highly judgmental word, committed. So that's something we can do today. If you aren't already doing it, we can gently correct ourselves. If you have been using the word committed for a long time, it can take a little time, but you'll be surprised at how quickly you can move towards using those words, died by suicide or took their own life. All right, let's go to the next slide. So here's our model that we're going to take a look at one step at a time. It's L.E.A.R.N, which makes it easy to remember because it's a word, and it stands for look for signs, empathize and listen, ask about suicide, reduce the danger, and next steps. So let's start with the first one, look for signs. So as I mentioned, sometimes, we can't always recognize the signs, but many times we can. And I like to think of it as a way of paying attention, right? It's a way of noticing each other and noticing when we can check in with someone and check in with one another. So not everyone, most people are not trained to recognize warning signs unless you take a training like this. But let's take a look at them so that you can begin to see what we're talking about with warning signs. And we talk about them in 3 categories: emotions and feelings, actions and behaviors, and experiences. And what we're looking for here is usually a change in how someone is feeling, how they're behaving. Maybe we become aware of an experience that they have that causes us to pay more attention and to check in with them. So what do you think? What do you think are some emotions and feelings that could be warning signs or that you have seen as warning signs? Let's just pop a few of those in the chat real quick. Being sad for more than 2 weeks. Yeah, an unending sadness. Numb, feelings of hopelessness, loneliness. Yes, that helpless and hopeless and lonely, very, very common. Disengagement, irritability is high, loss of interest, could be physical, chronic pain. Yes, and some of that may lead to a lack of appetite. Great, let's put up our list. You guys are doing great. You've named quite a few, and someone even mentioned the irritation and anger that some people feel when they're feeling this way, that irritability. Anxiety can also be, there could be a higher level of anxiety. And some of you are also mentioning something that can be true is that there could be a numbness and indifference, not having emotions, or an apathy kind of feeling. Some people may have mood swings going from very sad to very calm and happy. And sometimes also one thing we want to watch out for is if we know someone has had a period of depression and suddenly they feel really calm or really happy, that could be because they have made a plan to take their life. So if we notice a big shift like that, that's something we want to pay attention to. Okay, and what about actions and behaviors? What do you think we might see as far as actions and behaviors with a person who might be considering suicide? Isolating and withdrawing, that's a really common thing that we might see. Taking more risks, yes. Drinking, using substances, giving away things. Absolutely. Isolating, yeah. Missing work, yeah. Missing work, missing school. They could be writing about it. Yes, I think if that's what you mean by writing, it could be writing about death or suicide. All right, let's look at our list. You're doing a great job with covering all of these. So I think in addition to what you have said, we also know that difficulty sleeping or sleeping too much can both be associated with higher risk of suicide. We might actually become aware that someone is researching ways to die, making plans to die, acquiring lethal means. That can be more obvious signs. Someone already mentioned the reckless behavior. I think in addition to writing, we might hear more talking about death and suicide, joking about it. A lot of young people, sometimes that's even in their language of how they joke with each other about killing themselves or death. And we always want to let people know that we're going to take that seriously. So if we hear joking or statements about death, we're going to ask about that and get a bit more information. Or if we see that in writing, I see those as invitations to have more conversation. What do you mean by this? Can you tell me more about what you're talking about here? Those kinds of statements. And then also threats against self or others. And we know that self-harm can be a warning sign for suicide. And sometimes self-harm is an attempt to alleviate intense emotional pain with no intention of dying. And the only way we're going to know is if we ask about it. So again, that's an invitation to a conversation if we become aware that someone is harming themselves in that way. What do you think about experiences? What experiences might be warning signs, or that you have seen that could be warning signs? Loss of work. Yes. Breakup, any kind of relationship, right? A breakup, divorce, any of those types of things. A loss of a loved one, definitely. A loss of a loved one to suicide, or just a loss of a beloved. Could be a warning sign. Bullying, childhood trauma. But yes, death, trauma. There's trauma again. Yeah, you guys, I think you're great. Breaking up, bullying, trauma, any kind of life transition or change. We can put up our list so you can see you've got most of these already. If we add our list up on, there we go. So most of those you mentioned, I think we want, sometimes life changes and transitions are very difficult for people. So we really want to pay attention if we become aware that someone has had significant changes. That can include financial, that someone mentioned there too, trauma, repressed memories coming back from childhood trauma, current trauma, certainly all of that. It's not genetic. That's a great question, though. Does family history of suicide mean it can be genetic? It's not genetic, but it's more related to the sort of patterns of behavior and the impact of the trauma on the person. You know, it kind of, that's more of what it can be related to. There's lots of great discussion we could have about that too. We also want to be aware of discrimination. That could be if a person's experiencing any kind of discrimination linked to sexual orientation, gender identity, race, or ethnicity. Again, that personal trauma and also historical trauma. And that's trauma that's happening to a whole group of people rather than just an individual. And that can be things like colonization and genocide. Let's see. I'm going to read what's in the chat. Would you put someone who's choosing to die due to terrible and fatal illness in this category? That is a really good question. I mean, there is, in certain places, there is something called death with dignity, and I don't know if that's what you mean. That's different than suicide. And I think that's some people who are experiencing incredible pain do consider suicide. So that could be a warning sign, could be something that we just need to be having conversations about and talking about what's going on with them. Brain chemistry, some people talk about that in terms of things like mental illness or other types of illnesses that could be a warning sign, potentially. You're bringing up great things in the chat there to consider. But overall, what we're looking at is, we become aware of some experiences that a person has had, or we notice these changes in a person. And what that does is it brings us to our second step of the L.E.A.R.N, which is having a conversation with a person about what's going on with them and checking in. And a second step of our L.E.A.R.N is the E step, and that's to empathize and listen. And we can go ahead to the next slide. Might be a little delay in the slides on my end, but oh, I forgot, we also put in warning signs in youth. Some of you may be working with youth, so there can be some additional things to pay attention to, but we've already covered many of these. So stress over a loss, changes in behavior, not wanting to do things that they once enjoyed, having difficulty dealing with ordinary challenges, escalating that risk-taking behavior, talking about wanting to hurt themselves or wanting to die. We covered most of that, but wanted to highlight that those are some things that are fairly common in young people. All right, let's go to the next slide. Getting ahead of myself, moving into the empathize and listen. So in this second step where we're having a conversation with a person, this is such an important part of suicide prevention. This is such an important part of how we are with each other, right? To be able to listen deeply and to show empathy to another person. And we are about to watch a video by Brene Brown, where she helps us understand a bit more about what empathy is.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
I always think that video is worth it just for that last little bit, to really remind us that what makes something better is connection, and to give us a great thing to say, that if we don't know what to say, that it's okay to say that. I don't know what to say, but I'm so glad you told me. So here's an example, if a child or someone tells you they're struggling, what's the best way to demonstrate empathy? Is it to offer solutions to fix the problem because you don't want to see them hurting? Is it to share a story about a time something similar happened to you? Is it to sit with them and say, it sounds like you're going through a lot right now? Or is it to pull up a funny video on your phone and help cheer them up? You can put in the chat what number you think is the answer for the best way to demonstrate empathy. And I see a lot of the 3s happening. And that is the answer we're looking for, is to initially what we're really wanting to do is to listen, right? And to say, it sounds like you're going through a lot right now, and give them lots of space to talk about that. Yeah. All right, let's go to the next slide. So again, just to highlight what we're talking about here with empathy, what we're trying to do is see the world as another person sees it in a non-judgmental way, validating their feelings. We don't have to agree with their feelings. We don't even have to understand why they feel the way they do. We just have to communicate that we understand that is how they feel. So a person really feels seen and feels heard, right? All right, let's go to the next slide. So here's a few ideas about what to say, just like from the video. You could say, I don't know what to say. I'm so glad you told me. Tell me more, I'm listening. You must really be hurting. It's okay to be honest. I'm here to help. And if it's appropriate, if it is definitely someone in your life that you love, letting them know that you love them, no matter what. Next slide. So that brings us to the A step of the L.E.A.R.N, asking about suicide. So this is, what do we do if we are having this conversation, we're listening, we're showing empathy, and we feel like we need to ask about suicide? And many of you asked about that. What's the language? How do I do that? So let's go to the next slide. We're going to talk a bit about how to prepare for these conversations, because as we've mentioned, these are hard conversations. And if we can have the time to prepare ourselves emotionally and mentally, that is helpful. So that might include thinking about where and when you might have the conversation. It might be reviewing the L.E.A.R.N steps in your mind. It might be making sure you have some resources available to give the person, and then thinking about who you're going to talk to after you have this hard conversation, because it's a good idea to debrief with someone else. All right, next slide. So the way we ask about suicide is directly, to be courageous and direct and compassionate in our asking. So here are two ways. Are you thinking about suicide? Are you thinking about killing yourself? We really want to avoid vague language, like something like, are you thinking of hurting yourself? Right? That's kind of vague. There's lots of ways a person could hurt themselves. And what we're really wanting to ask about here is suicide. So we'll ask in a direct way. And when we do that, we really give the person the feeling that we're willing to have this difficult conversation, that we're willing to say the word suicide or say killing yourself, that we are showing up for them in this way. And we're more likely to get an honest answer when we ask courageously and directly. And we have a framework at Forefront that I really appreciate, that is so helpful in asking about suicide. This is another one of those most important takeaways from the training. This is the framework I use all the time whenever I need to ask anyone about suicide. And what we're doing here is we are using the warning signs that we have been observing or that have come out in our conversation with the person in the ask, so that it's personal, right? This ask is not coming from out of the blue. It is coming because we've been paying attention and we care about the person. And we also use the words people and they in this framework because that helps to normalize talking about suicide, and it helps a person feel that other people feel this way. So it can sound like, sometimes when people are feeling alone and hopeless about their future and like giving up, they're thinking about suicide. Are you thinking about suicide? So that's a bit about how that framework can sound. So when we ask, of course, we have to be prepared for an answer, right? And let's go on to the next slide. Just a reminder about when we ask. So we ask when we see those signs, when we know there are some big changes in a person's life or behavior. And a really important thing is when your gut tells you to. If you're concerned about someone, maybe you don't see a lot of signs, but you feel concerned. Remember, we learned that there is no harm in asking. So we just ask, because if they're not thinking about suicide, they'll say no, and then we can have a conversation about why we asked, right, and our concern. So if you're concerned, just ask. And let's go to the next slide. So what do we do if they say no, if we've asked? We want to stay neutral, right? And not show a big sigh of relief or any sign of relief. We want to stay neutral and non-judgmental. And that's important because, for one, we don't want to be dismissive of any pain that they're in. And we also don't know if they've been honest with us the first time. So we just want to just stay neutral, let them know we care about them. And if you're still concerned, you might talk a little bit more. And if it's appropriate, you could ask again. And a really important question to ask is, if you were thinking about suicide, who would you talk to? And that's an important question because it gives them an idea, gives them the thought about, who do I have in my life to talk to? And it also lets you know who they have in their life to talk to. And if they don't have anyone or they can't think of anyone, well, that can be where you can help them figure out who to call. And even if it's, you end up giving them the 988 number as a person, as someone to call, right? And then that's part of the R and the N steps that you would move on to. So what do we do if they say yes? Now, this is also, it's very hard to stay neutral and non-judgmental when you're sitting with someone who's just told you that they're thinking about suicide or thinking about taking their life. We definitely want to take it seriously. We want to thank them for their honesty, acknowledge the pain that they're in, and then we'll move on to the R and the N steps, because we have some other questions that we need to ask if someone says, yes, I'm thinking about taking my life. And then you get that support for yourself. Sometimes this comes up, you know, where this on the bottom here in the slide where it says they ask you not to tell anyone. How can you respond? People will ask about that sometimes. So I think that's where I usually talk about how important it is for them to be safe, and for me to, you know, to want to get them the help and support they need. And I just really try to talk about their concerns about that, like why they're worried about not telling anyone, giving them lots of time and space to talk about it some more, but ultimately coming around to a place of where it's important to tell someone, and it's important to get you some more support and keep you safe. All right, next slide. So now we're on to the R step, which is about helping to keep a person safe. So if we go to the next slide, we'll talk about your role. So remember, these L.E.A.R.N steps can be used with anyone you know, right? Anyone, because, and that's what's so important about them, is that they can be for someone that you're supporting, but they can also be for your child, a family member, a friend, a colleague. And so whoever the relationship is, you know, whatever relationship you have with the person is going to, you know, vary your role. But regardless, we can always identify who else can help, right? Who are the other trusted people that we can call upon to help? We're always going to continue to demonstrate the care and empathy. And then, as I mentioned at Forefront, we always talk about how we can reduce danger in our own homes as well. All right, next slide. Now, here are those follow-up questions that I mentioned. If someone answers, yes, I'm thinking about suicide, thinking about taking my life, we need to ask these important follow-up questions. Have you thought about how you might end your life? Do you have access to those methods? And have you thought about when you might do this? These questions give us an idea about how well thought out, you know, a person's ideation is, or their plan is, right? Maybe they don't have a plan. Maybe they just say, well, sometimes I think I'd be better off not here, but I don't ever think about how I might do that. That's a very different level of intervention that we might take than if someone says, yes, I have thought about it, and I have medication at home that I could take. And they may even tell you when they were thinking about doing it. So that's a much more imminent risk, right? Where we have to get help right away. So what we want to remember here, though, is that putting time and distance between someone who's suicidal and the methods that they may use can save their life. The next slide. So we think about what's in our home, right? So 56% of teens say that it's easy to get prescription drugs from their parents' medicine cabinet. 95% of parents that were surveyed didn't believe that their child would take a prescription drug for misuse. 90% of suicide attempts with a gun are fatal. 82% of youth suicides by firearm involved a family gun. And suicide is 3 times more likely in a home with a gun. So we just share these statistics because, I mean, many people are surprised by them, but ultimately what we're wanting to focus on here in the next slide is we really encourage people to lock up these items, right? So we know people have firearms for a variety of reasons, but we really encourage locking up all firearms, locking up prescription medications and over-the-counter medications. Many people aren't aware that over-the-counter medications can be fatal in large doses. And then if there's a crisis, there may be some other things that need to be locked up as well. And we have a Safer Homes website that has a lot of great information on this if you would like to learn more. All right, let's go to the next slide. So then we're going to be on to our end step, the next steps, and this is how we're going to connect someone to the support that could help them. And if we go to the next slide, again, we're going to think about what do we do if someone has told us they're thinking about suicide. We don't want to leave that person alone, right? We want to get some help immediately. That could be a counselor, it could be the 988 line or one of the other crisis or lifelines. It may involve asking trusted people in their life to help remove any danger from the home. And then after the crisis, if possible, we want to continue that connection we have with the person and check in with them and see how they're doing. And maybe there might be they might be connected to a doctor, to elders, to relatives, to school counselors, to community organizations, making those connections that are going to be supportive and helpful. And always we want to foster a culture of help seeking and remove any judgment from seeking help. Our next slide. So here's some helpful resources. We have a list of them. I think that may appear in the chat, or you may get that later in an email, our full resource list. We all want to be aware of 988 and what services can be provided there. There's also the crisis text line, 741-741, that has services in English and Spanish. We also have the Trans Lifeline and the Teen Link Lifeline for young people. Our list, Zoe just put it in the chat, contains many other resources. You might note that in Washington State, the 988 number can take us to a variety of options, one for veterans, one in Spanish, one for the Trevor Project for LGBTQ plus youth, and also the Native and Strong program. So that can be one number that can connect into a lot of other resources. So these are the really good resources to have, like in our phones, readily available for us when we need them. Okay, let's go to the next slide. And now we're going to move into looking at these learned steps in action, right? In a practice scenario is really watching this video, where we're going to watch for the warning signs. We're going to pay attention to look for warning signs. We're going to look for how empathy and listening are happening in this video. We're going to notice, how do they ask about suicide? What do they do to reduce the danger? And what next steps do they take? And then we'll talk about it after we watch the video, but it's very helpful to see these steps in action. So let's have a look.
Hey, I just want to check in. Because, we haven't talked in a while, just the two of us.
I guess so. What's up?
Well, it's just that I've noticed that lately things seem to be kind of rough on you.
Yeah, it's been pretty stressful lately. Can we talk another time? I just got back from school and practice, and I have a ton of homework tonight.
It's just that things don't seem to be getting any better for you. Just this past month, I've noticed that, you've been in your room way more than usual, and you don't seem to be hanging out with your friends anymore. So, you want to tell me a little bit more about, what's going on?
I don't know why this year feels so much harder. It's just stressful. Everyone is too busy, and there's just so much going on.
Well, I see you trying hard. But, you feeling like you're not doing enough? Hey, look, this feels important. You want to talk more about it?
I feel like I can't do anything right. I just mess everything up. This year is so overwhelming. It didn't used to be this hard.
I did not know things were so overwhelming. I hope you know that I love you, and I'm on your side. But if you don't want to talk to me, do you think you can talk to a school counselor?
No. How is that supposed to help? I don't want anybody finding out.
Okay. I just wanted to make sure you had someone to talk to. A lot of times when people are feeling overwhelmed and as stressed as you have been lately, they can start to think about suicide. Are you thinking about suicide?
I don't know. I'm just tired all the time. Nothing is going right. I feel like it's more work for everyone when I'm around. Nothing I do or say seems to help anyway.
Oh, are you saying that things are so bad that you might not want to do this anymore?
I don't know. It's just hard. I don't want this to be a big deal.
Johnny, have you been thinking about suicide?
Kinda. Sometimes I think about it. I don't know what to do. I don't want to feel this way anymore.
Okay, well, look, first of all, thank you for telling me. It takes a lot of courage to talk about this. I can only imagine how hard it is. So next, I'd like to ask you a few questions so that we can figure out what I can do to help support you.
Do we have to do this now?
Yes, we do. You're important to me. So I'm just going to ask, have you actually thought about how you might take your life?
Not really. The idea of suicide keeps popping into my head, especially at night. Sometimes I feel like it would just be better if I wasn't here. But it scares me too.
Oh, that must make you feel so alone when that happens. So, what do you think about?
Well, we have that Costco bottle of Advil in the bathroom. Sometimes I think about taking a bunch of it, but it kind of scares me too. I don't want to hurt anybody. I feel trapped.
Okay, well, I can see why that would be scary. Look, thanks for letting me know about the Advil. I think we need to take a look at what's at home so we can make sure that you're safe until you're feeling differently. I'll work on that today. Okay? Is there anything else?
No. I think that's it. It's especially hard at night.
Okay, well, look. I don't want you to feel alone in this. So next time you feel that way, please, just come get me and we can just sit and talk.
Thanks. Yeah, that would be nice.
No, thank you. Thank you for sharing this with me, okay? I don't know what our next steps are, but I know I want you to feel more supported. And I want you to feel safe at school and at home.
We're going to have to keep talking about this.
Yes, we are. This is important. And, well, suicide's a big deal.
I wanted to be able to handle it on my own. I did not want you to worry about me.
Well, we all need support sometime, okay? So I'm so glad you told me. This is way too much to handle alone. You know, earlier you mentioned that you didn't want to talk to your school counselor. So is there any other people in the community or someone at school that you can talk to about this?
I guess my English teacher. She kind of knows I'm stressed out and having a hard time.
Okay, well, that's good to know. It's nice to have someone to talk to. It helps you to feel less alone.
I don't even know what to tell her, though. What do I even say?
Good question. Well, we can figure this out together. Okay? I think I need some help, too. Hey, isn't there some information on the back of your school ID card?
Yeah, here.
Okay, well, what if we call the school counseling office or 988 together? I bet they'd have some good support and offer some next steps. Oh, but since it's after school hours, why don't we call 988? Are you willing to call with me?
Yeah, but can we text instead?
Sure. Let's start there. Do you want to text or do you want me to do it?
I'll do it. 988, right?
Right. 988.
All right. So here's our questions about those steps, and let's take a couple minutes to debrief here. What warning signs did you notice here? What was concerning? You can either, I think you can unmute yourself. You can unmute or you can use the chat though. Yeah. So eventually the Advil, right? We learned about that. And he was overwhelmed, has been in his room longer than usual. Yeah, more stress than usual. Yes. Wasn't going out with friends. More isolated. Yeah, felt really stressed out. So his behavior had changed. Definitely. Yeah. And seemed to be acting differently, right? Mentioned that things would be better without him. That was happening around that, yeah, a little bit later, but also important. What did you notice about empathy in the video? How was empathy displayed? How did the dad show empathy? Validated feelings, yes. Yeah, mentioning that he needed support too was a really good thing for him to do, I think. Yeah, he probably was listening. Yeah, and he said, imagining how hard this was, how alone he must feel. Just checking in on him in the beginning, right? It was important. Had a lot of concern, listening, great. And how did they ask directly about suicide? What did you notice there? All your comments are really great. Did you notice yeah, he was direct. Straight up asked him, use the framework. Yes, non-judgmental and respectful. And he re-asked, right? Stayed on the topic. Yeah, and he didn't freak out. He remained calm. Yes, really important. How did he begin to address removing and reducing the danger? You know, he asked him about if he thought about how, right? If he thought about how he would do it. Yeah. And then what about, yes, and removing possible dangers in the house? Also, yeah, offered to be with his son, right, at night when he's struggling more. And then finally, what next steps did you notice? I'm looking for resources like 988. Yeah, great. And the support like an English teacher. And I know someone mentioned, you know, that maybe the jump to talking about suicide seemed quick. sometimes it is quick, but sometimes, when you're creating a video for learning, we have to jump through the steps a little quicker than maybe even the conversation would have gone otherwise. Lots of great things here: offering to talk, offering to listen, texting the 988 line. Dad's learning too. Yeah, great. So good. So it's so good to see that in action, right? So let's go on to the next slide. We've just got a few more things to finish up here. So we talked about the public health issue of suicide, looked at some of those statistics. We kind of considered why people may think about suicide. And then also we focused on the learn, right? And went through the learn skills, and then watched them in this video and practice looking for the steps in the video. So we do hope that you will use what you've learned to reach out to someone in distress. It's not easy. It is, difficult conversation, but it can potentially be life-saving conversation, important to have. We're all going to use the term died by suicide, and have some good resources in our phone for when we need them, and think about ways in which we can make our own homes safer. And the next slide is a thank you. Really appreciate your participation and your attention here today. So thankful for all of you and taking this training. And we have a post-training survey that the link was just put in the chat. And if you want to find out more about Forefront, please do visit our website, follow us on social media for some of the other trainings that we do. And if you have any questions or thoughts after the training, please send us an email. But so grateful to be with you today. And if there are any other questions, I think we maybe have a couple minutes. If there are some that want to come out at this point, but yeah. Someone said, okay, there's a thing which I felt a little uneasy during the father and teen interaction. I think it would have been useful to ask about the origin or cause of the stress and the overwhelm, not just the current situation or feelings. What do you think? Yeah, I mean, I think that really staying in the moment is hard sometimes for us, but I think it can be really helpful. And there will be time to get into sort of what can we do to problem solve, and reduce maybe some of the origin of the stress and overwhelm. But I think in that moment, it was really about just making sure Johnny felt heard and safe and cared for. I mean, there wouldn't have been anything wrong with asking a question, perhaps like, of what's causing you to be stressed, what's the overwhelm about? I mean, there wouldn't have been anything wrong with that, though. But I think that's why they stayed in the present moment, if that makes sense. And certainly as we go further into the support, definitely that's when problem solving can be helpful, right? Later on down the line when we're looking at, okay, now how do we help Johnny be less overwhelmed, right? Yeah.
Thank you, Charlene. That was a really important question.
Yes.
Any other burning questions before we move to our next part? I think that we have just a few minutes left, and I think there's a lot of digestion. I would just want to take 5 seconds for everybody to take a deep breath in and check in and make sure that how you're feeling about all this information, and it's potentially possible to get other questions later on, and please feel free to check. So Charlene, once again, thank you for making this digestible in a way that makes sense to all of us, and for your great work on saving lives.
You're so
All right.
welcome. Thank you.
Thank you. So do we want to go back to our slides and see? I had a chance to take a look at our Padlet. Won't spend too much time with that, but some stories, I even saw poetry, and in a little bit you may find out why this is particularly touching for me. So we can just, yes, thank you. How many of us have carried stories that where we've seen other people that have died by suicide, and our families don't talk about it, we pretend it doesn't happen. So thank you so much for not only talking about the difficulty on talking about suicide, but then when it does happen in our inner circles, how it's been so difficult for many people to process that because it's not talked about. So thank you so much for your candor and for the powerful message, the importance of destigmatize suicide and mental health in general. Can we go to the next slide, please? So we are going to skip the self-care and save it for next week. We still have the opportunity to ask any pending questions for our wonderful licensed mental health professional, Shakira, as our time with Forefront has ended. And please feel free to reach out afterwards if you need to. Any pressing questions for Shakira? Just making sure we're all remembering to breathe and to check in. So if there are no questions, we have one last video. We have, well, oh, Isela had a question. Isela? You can unmute yourself. Thank you.
Oh yeah, so in that scenario with the video, what would be like the follow-up once the son, you know, they're already in counseling, and what is like the follow-through the parent should be doing, like how often to check in or whatnot?
Kira,
Yeah,
what would you suggest? Yeah.
that's a really excellent question. Not surprisingly, right? There's probably no hard and fast rules about when or how often. I would say like early and often in a way, right? That we want to make sure that we are conveying as parents and safe adults in young people's lives, that we're not just going to do a one and done and then be like, whoop, we're relieved, and we handed you off to the professionals. So checking in before and after that first counseling session. One of the things that I thought of like lots of my nieces and nephews and the family cultures in the lives of people that I'm connected to. And I think about like, how do you establish a regular culture in your family of checking in and talking? Right. So I have close friends who have 3 kiddos. They're currently middle school age kids. But ever since the kids were toddlers, when they sit down for dinner as a family, that's regular practice. They do as much as they can with busy young people lives now. But one of the things that they do is they'll go around and tell us about your day. And when I'm there, they'll say, Titi Shaki, tell us about your day. And sometimes we do high highs and low lows. So what was 1 or 2 high highs or really good moments in your day? What was maybe some low lows in your day? And, gotta love young people. Sometimes the low lows are like, they ran out of chicken nuggets. And sometimes the low lows was somebody was mean to me in class. Maybe it's like this parent did in the video on a ride home from school after pickup, creating that culture of checking in and nurturing conversation. And one of the things I was taught from a mental health mentor of mine was that even when young people don't engage or if they give us very little, to continue to ask, because what we want to do is always have the door open so that they always know we are here, we're always ready, and we always want to hear about you, your life, what's going well, what are you struggling with. So don't get discouraged if folks, young people maybe are like, meh, it's fine, or I don't really want to talk about it. And say, okay, cool, I'll check in again later. Maybe it's in the evening before bed, maybe it's in the morning while there's breakfast. So thinking about what makes sense in your family culture and building it into routines, I think can be very helpful.
Thank you, Shakira. I don't know what I love more, what you share or the Titi Shaki. That is so sweet. That is so sweet. And I think that a point that I would like to share that's really important is that the communication doesn't start when they're 13, 14. That is basically what Shakira is talking about. We need to have that open conversation when they're very little, so we're a safe place. We don't freak out, we listen, we don't jump to conclusions, we don't lecture them. And that starts very early on, because by the time we find out when they're teens that there are issues, they may or may not feel comfortable talking to us. So please make sure that you don't wait till they're teenagers to talk about anything, including how they're doing. Of course, a 3-year-old, you want to ask, are you thinking about suicide? Of course, that's not the conversation, but if you give them the space to share how they're feeling, to put words into that, and that you welcome that, will make it much easier when they're older to have the tougher conversations.
And I would add, it's okay if
Yeah.
you're starting, if it feels like it's a late bloom conversation, if you are starting when they're
Yeah.
teenagers or adolescents. And I think one of the things that we can do as adults is model that, to say, I grew up in a culture where we didn't talk about these things, but I've learned now that it's important. And we could even apologize. Like, and I'm sorry I never asked you about this before. And I really want to know now. And would you join me in learning how to talk about this in our family?
Thank you. That is very powerful, Titi Shaki. So what do we have next? We have some oh, do you want to go there? Okay. So let's go ahead and do just to leave us in a little bit of hope. There's hope at the end of the tunnel. Not everybody who wants to gets to have the support and the love. And some people are here still because other people care. So let's go ahead and get the video started. Not sure why there is no sound, but I think the music is not very
It's
good
playing.
quality.
The song's
Yeah,
playing.
I think it's just the quality might not be other music. Okay.
Yeah. Wait. Okay. Okay. Ya tengas un buen. I did it. I did it. So what are you reading?
Right. Jody?
Yeah, we're going to move on just in closing to share with you some upcoming events. If you'd like some more advanced training on this topic, we are actually going to be working with Forefront on a more extended training in person on Wednesday at Skagit Valley College. This will have live English to Spanish translation and a light dinner to go along with it. And we're making this free. So it's a free training to everybody who can make it. You can go ahead. There's still time to register. We still have a few more slots available, or you can email us and we'll get you registered. So, so there's that. And then our next thing that we want to share with you, of course, is Mindfest. That's coming up on May 9th from 1 to 7 p.m. at also Skagit Valley College. We have some really amazing workshops, speakers, some fun, animals, arts, you name it, it'll be there. Even if you can just join for the evening, we'd love to have you. You can find out more about that on our website, mentalhealthmatterswa.com, and click on Mindfest, where you can look at the schedule, more detailed schedule there. If some of you, I think, have already signed up for volunteering, and we thank you for that. There's still time for that as well. You can also volunteer straight from our website as well. So we look forward to seeing you there. And of course, here's our contact information. Thank you all for joining us today. We know you could be anywhere and you've chosen to be here. And we're hoping that this message today, we can incorporate this into our daily lives as we go along, and it'll be helpful for all of us. So thank you so much. And we will look forward to seeing you next week at our very last session together. So thank you so much, and we'll see you then.
Thank you.
I think it's just us now. Yeah, it's just us now. That video, Sandra, every time I see it, it's just, it is so hopeful. It's the best thing to put at the end there. So I
It
hope
gave
Ray
me
knows.
Whole body goosebumps, which doesn't happen often. That was really moving.
Please let Ray know too, because I don't know that Ray knows how powerful that has been and how many lives have been touched from all of the efforts and the vulnerability that they have with sharing that story with us.
Yeah, we'll have to do a little update, but every now and then I hear from them. I am so glad I did not succeed.